Hi, this is Dr. Tenner here at the Goldberg Clinic for Chronic Disease Reversal. And today we have with us Ms. Shanta Williams. And Shanta came to see us back in July of 2012. Shanta, please tell our audience a little bit about what brought you in to see us.
I initially came to the Goldberg Clinic with problems of constipation, bloating, lots of acid reflux. I had lots of horrible skin issues initially. So those were some of my symptoms coming into the clinic.
Okay, and it's my understanding that you had sought medical treatment for these issues. And so you went to see your medical doctor, and what did they tell you?
My medical doctor told me that I had acid reflux, or GERD. And so I was prescribed Prevacid or acid blockers, and I took that for a few months. Didn't have a lot of success with that. I always, would sometimes regurgitate my food from taking those, the Prevacid. So I wasn't on it for long. I just couldn't do the medication. I had issues with, I noticed after that my hair started falling out. My skin issues were even worse than what I initially had. So I got myself off of it.
Okay. I think it's important to point out that gastrointestinal issues, particularly the ones that Shanta was dealing with, from constipation to irritable bowel type symptoms, are becoming increasingly common in our population today, as well as acid reflux. And one of the most common treatment protocols for these issues is the prescription of acid blockers, things like Prevacid. And while they may temporarily relieve the patient's symptoms, they tend to cause way more problems than good. The acid in your stomach is necessary in order to digest your proteins, make your minerals soluble, and kill off any bacteria that might make its way down into your GI tract. And so if the acid's not there, it opens up the potential for serious problems to occur. And we see that quite often in patients. We oftentimes see patients who have gastrointestinal issues then develop things like autoimmune issues, skin problems, amongst other things, simply as a result of taking acid blockers over time. So we had Shanta into our clinic. We did some investigation with her. We discovered what's called a small bacterial overgrowth as a result of taking antacids for a period of time. And so we developed a program for Shanta to follow, an individualized program specific to her needs. And over time we started to rebuild her health and restore proper function to that GI tract. Okay, so Shanta, what kind of changes have you noticed over the last 6 months?
Oh wow, significant changes I would say in my skin. My skin has improved. I don't have the bloating and the burping like how I used to, and my bowel movements are, pretty consistent at this point. So no more of the constipation as I used to have. Lots of changes. I would probably say about 80% improvement in my symptoms that I came in with, so much improved.
Well, we're very pleased with the improvements that Shanta has made over the past 6 months. We still have some work to do, but we've seen a lot of progress made, and which is largely due to the fact that Shanta has put in the hard work in order to make these improvements. We can only do our best to point the patient in the right direction, but the patient has to go home and do the hard work and have the will to get well, which Shanta does. So Shanta, we look forward to continuing to improve upon the progress that you've made thus far, and we thank you very much for joining us today.
Thank you, Dr. Tanner.
Thank you.